Hey, Jack. I'm really nervous about my doctor's appointment tomorrow. You know, I'm not very good with medical terms and stuff. What if I can't understand what the doctor is saying?
Oh, don't worry, Tom. I've got your back. Just focus on a few key terms and you'll be fine. First off, when you enter the clinic, you might hear the word receptionist. That's the person at the front desk who checks you in.
Receptionist. Got it. What about when I meet the doctor?
Well, the doctor you'll be seeing is often referred to as a physician or medical practitioner. They might also be called your healthcare provider. When discussing symptoms, use words like symptomatic for having symptoms and asymptomatic if you're not experiencing any.
Okay, physician, healthcare provider, symptomatic, asymptomatic. That's helpful. But what about the examination room?
The examination room is where the doctor will assess you. They might use terms like diagnosis when figuring out what's wrong and prescription if they need to give you medication. Also, if they suggest further investigation, they might use lab tests or medical imaging.
Diagnosis, prescription, lab tests, medical imaging. Got it. Anything else?
Sure, when talking about medications, you might hear dosage for the amount prescribed, side effects for potential unwanted effects, and contraindications for situations when you shouldn't take a particular medication.
Dosage, side effects, contraindications. I appreciate this, Jack. I feel a bit more prepared now.
If the doctor mentions your medical history, they might use terms like chronic for long-term conditions and acute for sudden and severe issues. It's important to be clear about any pre-existing conditions or allergies.
Chronic, acute, medical history. Got it. I really appreciate you going through all of this with me, Jack.
Of course, Tom. One last term, follow-up. If the doctor suggests a follow-up appointment, it means they want to see you again to check on your progress or discuss any further steps.
Follow up. Got it. I feel much better now. Thanks for helping me brush up on these terms, Jack.
Anytime, Tom. You'll do great at the doctor's appointment. Just focus on understanding these key terms and you'll be able to communicate effectively. If there's anything you don't understand, don't hesitate to ask the doctor for clarification.
I will, Jack.
Tom, let's cover a few more important terms. If the doctor needs to examine a specific area, they might use terms like palpation for feeling with their hands and auscultation for listening, often with a stethoscope.
Palpation, auscultation. Got it. What about when they check my blood pressure?
Good question. When it comes to blood pressure, they'll mention systolic and diastolic pressures. The systolic pressure is the higher number reflecting the pressure when the heart contracts, while the diastolic pressure is the lower number indicating the pressure when the heart is at rest.
Systolic, diastolic. Gotcha. What about those machines they use to see inside the body?
You mean medical imaging. There are various types like X-rays, MRIs, magnetic resonance imaging, and CT scans, computed tomography. They use these to get detailed pictures of the inside of your body.
X-rays, MRIs, CT scans. I'm learning a lot here, Jack. Thanks.
No problem, Tom. Now, if the doctor prescribes any medication, they might use terms like generic for the non-brand name version and brand name for the specific name a company gives a medication.
Generic, brand name. Got it. Anything else I should know?
Yes, when discussing symptoms, they might ask about the onset when the symptoms first appeared and the duration, how long they've been present.
Onset, duration. I'll remember that. What about the terms related to medications?
Excellent question. If the doctor prescribes a medication, they might discuss the dosage frequency, which is how often you should take it. They could also mention over-the-counter medications, which you can buy without a prescription, and prescription medications, which require a doctor's prescription.
Dosage frequency, over-the-counter, prescription medications. I'm learning so much, Jack. Anything else?
Yes, if the doctor recommends a change in your lifestyle or habits for better health, they might use terms like dietary modifications or lifestyle adjustments. And don't forget to ask about any potential side effects of medications or treatments.
Dietary modifications, lifestyle adjustments, side effects. Got it. I really appreciate your help, Jack.
No problem, Tom. One more thing, the doctor might use the term prognosis to discuss the likely course and outcome of your condition. It's important to understand what to expect in terms of recovery or management.
Prognosis. I'll make sure to ask about that. Thanks again, Jack. I feel much more confident now.
Happy to help, Tom. Just go in there, be yourself, and remember, the doctor is there to help you. If you have any questions, don't hesitate to ask. Good luck with your appointment.